It's another symptom of COVID-19, and doctors are calling it a crisis, the blood shortage. Many hospital shelves only have half their usual supply. In fact, the Red Cross and ImpactLife are calling it the worst shortage in more than a decade. This is not a hospital, but it is an emergency room. That's because what's stored here at ImpactLife is the lifeblood of emergencies, literally.
ImpactLife supplies to over 125 hospitals throughout our region, which is Iowa, Illinois, Wisconsin, and Missouri.
And they're sounding the alarm. If this were the military, they'd be at DEFCON 1.
Blood centers all throughout the country are experiencing levels of inventory that are below anything they've seen in the past 10 years plus.
The blood donation deficit is a byproduct of the pandemic, which has caused canceled blood drives, staffing shortages, and donor fear of COVID exposure.
There's not a whole lot that I personally remember.
43-year-old Brian Dawes of St. Charles is a nature lover.
Personality-wise, I like to be outside hunting, camping, fishing, four-wheeling, stuff like that.
But this outdoorsman recently found himself inside the intensive care unit at SSM Health St. Joseph Hospital.
I was in a lot of pain. My hoodie was drenched in sweat. I was moaning and groaning, and I couldn't really stop it.
He had to be rushed into surgery for a life-threatening abdominal aortic aneurysm.
Brian was going through a lot. He was very, very sick.
I remember them asking me, somebody asked me, what day is it? And I answered the following day. I didn't know it was 8 days later.
He says he's grateful for his care team and for the units of blood that helped him merge onto the road to recovery.
If we don't have blood, that's a huge deal. Patients' lives are at stake.
Back at ImpactLife, they're hoping for a circulation of confidence even in this pandemic.
We have cleaning protocols, we have masking protocols, we have vaccination requirements for our staff.
And as Brian Dawes found out, you don't have to be a doctor to save lives.
To be honest with you, I would say that the last time I had the opportunity to give the blood, I said, well, I will if I have to. And I can assure you from now on, I'm going to give blood. It saved my life.
And Brian says just as important as his care was the care shown to his daughter, Shayla, at SSM Health St. Joseph Hospital. For more information on giving blood, you can go to bloodcenter.org. At-home COVID